Good evening, I'm Dennis Ward. Welcome to APTN National News. We want to begin with a warning tonight. This story is about residential schools and a disturbing discovery. Some information may stir up or trigger unpleasant feelings or thoughts. The remains of 215 children were found at a former residential school in British Columbia. The Kamloops Indian Residential School was one of the largest residential schools in Canada. The horrific discovery was made with the help of a ground-penetrating radar specialist. In the news release, Chief Roseanne Casimir of the Kamloops Secwepemc First Nation said the remains were found last week. She called the discovery an unthinkable loss, but one that was never documented. A local archivist is working with the Royal Museum of BC to try and find records of death. They're reaching out to other communities whose children attended the school in hopes to bring peace and closure. A press conference was held today online.
You know, it happened right here. We need that support and we appreciate that support. You know, when we think and put ourselves into the shoes of the parents, you know, and the families that have been impacted by the find, we know that it is spread right throughout Canada, and we know that, you know, these are undocumented and unconfirmed, and, you know, unconfirmed as identity.
The National Indian Residential School Crisis Line is available for survivors and others who might need support. That number is 1-866-925-4419. It's day 10 of the Echaquan Commission, the coroner's inquest examining Joyce Echaquan's highly publicized death at Joliette Hospital in Quebec last September. Today, the coroner brought out the big guns, questioning the former president of the Regional Health Authority overseeing the hospital. Lindsay Richardson joins us from the courthouse lawn with the latest. Lindsay, thanks for being with us. There's been a pretty unflattering picture of Joliette Hospital emerging. What did the former president have to say about the working environment at that hospital?
Well, one of the first things that Daniel Castonguay explained today was how difficult it was to get answers once he was first informed about what happened to Joyce. Now, that has to do with the way that the healthcare system is structured here in Quebec. So the simplest way to explain it, each region in Quebec has its own integrated service center, and under that umbrella falls every hospital, every clinic, every youth protection service agency, and obviously a lot of managers. There are a lot of people responsible here and a very complicated chain of command. So that's something that he spoke about today. But if we're talking about the actual environment in Joliette, Castonguay did mention that he's been working with the Atikamekw Nation since about 2015 to address service gaps. Providing ambulance service was one. Translation services was another. Cultural sensitivity training was an issue that was identified, and it was supposed to come to Joliette Hospital by about August of this year. The pandemic complicated things. We don't have an update now on what the status of those cultural sensitivity workshops are, but he did reveal that there was an external investigation in 2019 that found that Joliette's culture in general is toxic. There's harassment between employees, and while Castonguay could not say whether it is a specific anti-Indigenous racism problem, he did say that seeing the video that Joyce put on Facebook was an embarrassment for both the hospital and for the system overall.
Lindsay, we're a couple weeks into this now. Have we gotten any closer or gotten any more information about Joyce's official cause of death?
Dennis, it's a really important question, and it's been repeated almost every week since Joyce died in late September. Caro Dubé, her husband, in the first week testified that he was told no autopsy was performed at Joliette Hospital because Joyce had died of natural causes. But at the same time, he was told 2 liters of blood were pumped from her stomach at the time of her death. So we heard from a pathologist yesterday from the McGill University Health Centre who was ordered to perform an autopsy as part of this commission, and he determined that severe cardiac cardiomyopathy was likely what caused Joyce's death. That is a disease, a cardiac disease. It involves weakening of the cardiac muscles, and we knew that Joyce already had a host of other health problems, cardiac issues included, but it leaves other questions. He said that her lungs were filled with fluid. He said she was pale and almost comatose before the time of her death. Her hands were shaking. She was in sweats. There are questions about whether she received 2 doses of medication or doses of medication that counteract with each other. So it is cliche to say, but we are left with more questions than answers at this point, and it is the coroner's job to release a report that will trace the chronology from the beginning of her hospitalization to the end, what she received and who was responsible for her care.
Hearings expected to continue next week, Monday to Wednesday. What can we expect?
So we're now in the recommendation phase of the commission. So this is where the main players give what they think are the takeaways from the last couple of months between Joyce's death and now, when the commission actually got underway. So we'll be hearing from the leaders of her community, leaders of the Atikamekw Nation, and leaders of a provincial scale, the Assembly of First Nations Quebec Labrador. But on Wednesday, we're going to have a peaceful march here in Trois-Rivières, making a stop outside of the Palais de Justice. And Manawan, Joyce's home community, actually put out a press release this morning saying that they are allowing a statutory holiday for the community so that people can come down and participate in that march. So we will be here and we'll be bringing you the latest from the scene as that unfolds. We've heard at least 3 buses are going to be making their way down. So stay tuned. We'll bring you the latest as it unfolds.
Well, it sounds like, Lindsay, that's going to be a busy, important week. We know you'll be there. Appreciate your reporting on this and spending some time with us here to talk about it today.
Always a pleasure, Dennis. Thanks for having me.
Moving now from Trois-Rivières to Val-d'Or, where Quebec's Minister of Indigenous Affairs and Health made a quote-unquote historic investment to improve health care access for the province's urban Indigenous population. $27 million to improve service delivery and collaboration with community groups was announced. And although the funding announcement comes at the same time as the Echequan hearings, Indigenous Affairs Minister Ian Lafreniere says it's a response to 2 calls to action from the Vienne Commission, which criticized the treatment of First Nations and Inuit in Quebec's public services system. Part of the funding will expand an Indigenous health centre in the Val-d'Or region. The family of a First Nations mother says they never gave permission for the 31-year-old to be transferred to another province after getting COVID-19. Crystal Mousseau died earlier this week after the province attempted to transfer her to Ontario to receive medical care. Manitoba hospitals are filled with critically ill patients who have contracted the virus, resulting in the need to transfer people out of the province. As Brittany Hobson reports, Manitoba officials are investigating what took place.
On May 23rd, Crystal Mousseau's family received a call from health officials. The 31-year-old from Ebb and Flow First Nation was being transferred to Ontario. Mousseau was in the intensive care unit at the Brandon Regional Health Centre after contracting COVID-19. Christy Mousseau says the family never gave permission for her sister to be transported.
They phoned and said that they were going to take her to Ottawa for more treatment. They were going to take her to Ottawa for more treatment, and my mom didn't want them to take her there. They attempted to do it.
Mousseau was supposed to be transferred the following day, but there were some complications, so she was moved back to Brandon Hospital. Shortly after, Mousseau died. 2
a.m. on Tuesday, May 25th, my mom got a call that my sister passed away. If she wasn't moved, I believe she would have had a fighting chance.
Mousseau was hospitalized on May 16th. 5 days later, her sister says she had to be put into a coma to help her lungs.
That's the last time I'd spoken to her, on May 21st, when they pushed her to be in a medical induced coma. Something she didn't want to do, something my family didn't even have a say in, didn't want her to do.
Manitoba is in the midst of a punishing 3rd wave of the pandemic. ICU and hospitals are at capacity, leading to the province transferring patients out of province to Ontario. Many, including Grand Chief Jerry Daniels of Southern Chiefs Organization, have criticized the move.
I think the transportation of citizens in different areas throughout the province is problematic.
Manitoba has had to transfer nearly 30 patients out of province. First Nations people make up 40% of the current ICU patients.
The impact that First Nations have from a case of COVID is just so much higher. We're just so much more vulnerable to serious conditions that surround COVID-19. And like I said, that's because of the underlying health conditions that First Nations find themselves in.
In a statement, a Shared Health spokesperson said, the current demand for ICU beds is such that the healthcare system must look at every alternative to create capacity and continue to provide care to every patient as they present themselves. As a result, Shared Health has determined it necessary, with or without patient-family consent, to move patients to facilities in other provinces to create more capacity in Manitoba. During question period on Thursday, Premier Brian Pallister said a review is underway to determine what took place during the transportation and how to prevent something like this from happening again. In the meantime, community members are fundraising for Mousseau's 2 young daughters. Brittany Hobson, APTN National News, Winnipeg.
And we'll have the latest on the COVID-19 situation coming up after the break. Welcome back. Now to the latest COVID update from Ottawa, where the Chief Public Health Officer says Canada is over the 3rd wave of the pandemic, except in Manitoba. As Jamie Patch-Gumscum reports, federal officials are still stressing caution when easing up on restrictions.
Dr. Teresa Tam says vaccinations are going extremely well, particularly in Indigenous communities and in the territories. 22 million doses have now been administered nationally, and Dr. Tam says infections across the map are down.
However, where infection rates are still very high, such as in Manitoba, hospitalization rates have not yet begun to decline. With an average length of stay of 2 weeks for people hospitalized with COVID-19, or close to 3 weeks for those experiencing more severe illness.
In terms of vaccines, Pfizer will be delivering 2.4 million doses per week in June, with 9 million more in July. Procurement Minister Anita Anand also announced a new delivery schedule from Moderna.
We can expect 500,000 doses to arrive in Canada in 2 shipments starting next week. In addition to this, there will be 1.5 million doses arriving in the country the week of June 14th. I would like to be clear on this point. Moderna assures us that there will be millions more doses arriving in Canada before the end of June.
Dr. Tam says we are over the crest of the third wave, but it's not over yet.
This downward trend shows that measures put in place across the country are working to suppress the third wave as vaccination continues. While this forecast is very encouraging, it reaffirms that now is not the time to relax our measures. If measures are relaxed, increasing the number of community-wide in-person contacts, resurgence is likely.
Jamie Pashagamskam, APTN National News, Ottawa.
To Nunavut now, where a shack caught on fire last night on Iqaluit Beach and can be seen all over Nunavut's capital. There was also dramatic rescue that was caught on video. Our Ken Driscoll explains if you live in Iqaluit, the fire wasn't that big of a surprise.
You could see the thick black smoke from all over town. Iqaluit Beach is lined with wooden shacks and fires are not uncommon. But you don't see this every day. 2 RCMP officers pulling someone out of the smoke. Janet Brewster is Iqaluit's deputy mayor. At last night's city council meeting, they talked about the hazard the shacks pose. Then, the fire showed it even clearer.
Last year we ran into problems with a lot of incidents that were going on down at the beach on QIA lands, Inuit-owned lands that hold a number of shacks that people live in and sometimes party in, and in that discussion last year I had made some suggestions about how they could mitigate risk for people living in those shacks. And
the beach is Inuit-owned land, run by QIA, the regional land claims organization. But it is within the city, making the shacks a city problem as well. Brewster and council were meeting with QIA last night to prevent a tragedy.
And it just so happened that within an hour after that discussion, a shack caught on fire, and the adjacent shacks also caught on fire. And we know that somebody was in one of those shacks, and that person was pulled out by the RCMP.
Brewster's son was the person who shot the video. Just how small is Iqaluit? The last time we had Brewster on APTN National News was earlier this year. RCMP held her son at gunpoint for walking in a residential neighborhood with a rifle on his back, a common sight in Iqaluit. She video recorded the entire incident. This time, the man who was held at gunpoint on video for going hunting filmed the RCMP doing something heroic.
The relationship with the RCMP is really complex between the RCMP and the Inuit community here in Iqaluit and everywhere, really, and that incidents that occur that put that relationship at risk and put that trust at risk have a deep impact on people, on individuals, and at the same time. We still appreciate the good things that the RCMP are doing, and what we saw last night was 2 RCMP members potentially saving the life of an individual who has had to live in a shack.
You can't miss the problem at the beach if you live in Iqaluit. It's there right in front of your face. Same thing applies to the RCMP. Policing in Nunavut is a problem. The long-term solution will be difficult for both. But short-term, This person in a shack was very happy to see the RCMP. Maybe that's a good place to start. Ken Driscoll, APTN National News, Iqaluit.
New episode of APTN Investigates debuts tonight right here after the news. We'll speak with the award-winning reporter behind the new documentary after the break. Welcome back. Time now for our photo of the day. This photo was taken by Yukon Conservation Services. This calf was brought in by a member of the community. Conservation officers couldn't say if the calf is in fact an orphan. Certainly cute. You can send your pictures to share@aptn.ca for your chance to be our next photo of the day. Time now to take a look at tomorrow's weather forecast. Starting on the East Coast, 15 for Halifax and Fredericton. +1 in Inukjuak, snow and 5 for Kuujjuaq. 18 and sunny for Montreal, sunny and 10 in Chibougamau. 18 under sunny skies for Sault Ste. Marie, 14 with showers in North Bay. 12 and sunny in Thunder Bay, 19 under the sun in Sioux Lookout. 19 with showers for God's Lake and Norway House. Sunny and 20 for Winnipeg, 21 with rain in Dauphin. 19 with rain for Regina, 20 for Saskatoon and North Battleford. 18 in Meadow Lake, showers and 14 for La Ronge. In northern Alberta, 18 with showers for Fort McMurray, 20 in High Level. 19 and sunny for Edmonton, 19 and sunny for Lethbridge. 17 and sunny skies for Vancouver, 1 degree warmer in Victoria. 10 with rain for Dease Lake, showers and 16 in Prince George. 7 in Old Crow, 14 for Whitehorse. 14 in showers in Yellowknife, 21 in Fort Liard. 0 in Sax Harbor, +1 with snow for Paulatuck. +3 and snow in Chesterfield, snow and 2 for Whale Cove. -4 with snow in Resolute, 1 below in Arctic Bay. Tonight, APTN Investigates looks into a decades-long fight for recognition in the Northwest Territories. In the 1960s, a small group of Dene were forcibly removed from their homeland and relocated by the federal government. Video journalist Cullen Crozier is here to talk part one of his episode, Refugees in Our Land. Cullen, thanks for being with us. What can you tell us about the historic community of Rosher River?
Yeah, there's a long history there, Dennis. Yeah, the community of Rosher River, kind of as it became known, it was essentially an old settlement in the Northwest Territories. You know, from about 1920 to 1960, that was kind of the more modern version of Rosher River. And it kind of opened up from the fur trade, which, you know, a lot of communities in the Northwest Territories here, that's how they opened up the fur industry. Now, what we show in the documentary, though, is that there were people in that region, the Tatsotene, you know, for generations before that. So nobody really knows, you know, how far back that community, that settlement really went. We trace it back in the doc to the early 1800s, but the people that we spoke with, you know, they all say it went back a lot further.
So why was the community then abandoned by the federal government?
Yeah, that's a good question. There was kind of a series of events that all kind of happened at the same time that, you know, led to the federal government abandoning that community. One of them has to do with the development of this mine. Essentially, they found a lot of deposit of lead zinc ore about 100 kilometers away from the community, and they wanted to develop this mine, the Pine Point Mine. And in order to power it, they wanted to construct a dam, the Tolson River Dam. So those were two big events that happened that kind of led to the community being abandoned. There was also a fire at the community's only school. The community's only school burnt down in the early 1960s, and the government made the decision not to rebuild. And that really had a big impact as well, because a lot of the families, you know, their children had to go to school. That was the law. And so they had to move from the community in order for that to happen, because the government wasn't going to build a school there anymore. So there was a number of events.
So what did happen to the residents of Rosher River?
Yeah, you know, basically, you know, the government of the day, you know, essentially they didn't leave them any other choice but to leave. So the residents of Rosher River were essentially scattered throughout the north. And what we, again, explore in the documentary was the feds made the decision to kind of force them into other bands. So the Tatsotene, the Rosher River Band, they were original signatories to Treaty 8 in 1900. They were essentially erased from the history books, and their band membership was forced to join other bands all across the north. And so we look at that too, and kind of their fight for recognition over the years and trying to get the band reinstated.
Pretty interesting story here. Really looking forward to it, Cullen. We'll have to leave it there, but appreciate you joining us, and good luck tomorrow night too, buddy, on your CAJ nomination.
Thanks, Dennis.
Cullen's actually up for 2 awards tomorrow night at the Canadian Association of Journalism Awards. APTN News and Investigates has 6 nominations in total. Good luck to everyone. And you can catch Refugees in Our Land Part 1 in just a few minutes from now, following the APTN National News. That's all the time we do have for this Friday. For more on anything you saw here tonight, visit our website, aptnnews.ca. I'm Dennis Ward. Thanks for joining us. Take care. Have a good day.